So do you know what type of pill to take for your pain? In this video, I'll kind of walk you through that. And for context, I'm a big believer that if you're in a bit of pain and you can handle it, just don't take anything. I'm not someone that pushes pills on my patients, but I will walk them through if they are struggling with pain and they can't manage it, what they would take. For context, I've popped an Achilles, tore a meniscus. I rarely took any painkillers, even when I had surgery, just because I didn't like the way I thought on some of those drugs, and I didn't like taking painkillers, and I still don't. So first baseline is usually paracetamol or acetaminophen if you live in the States. Same drug, same compound. Pro tip, just buy the generic version of these. Like, they're no different. If it says maximum strength on the box, you're just buying the wording on the box as opposed to a different drug. Sometimes drugs are cut with like caffeine or something like that, but yeah, you're gonna pay, I don't know, 5 to 10 times more for caffeine plus paracetamol or acetaminophen. Doesn't make much sense. Next step up after that is non-steroidal anti-inflammatory drugs. Some patients can take it, some can't, depending on the risks. So those are things like aspirin, ibuprofen, naproxen, diclofenac. Next level after that, and again, it depends and you need to talk to your doctor, but I usually think in terms of like 2 different paths. Neuropathic drugs, so pain that's like burning sensation, electric shock, pins and needle type pain. That's more like nerve pain. And then the opioid class. And so the nerve pain group is things like amitriptyline, gabapentin, pregabalin, sometimes topiramate, sometimes using like duloxetine for diabetic neuropathy. So if you're getting pins and needle pain from diabetes. Next group is the opioid group, comes with a lot of risks. So opioids are things like codeine, tramadol, morphine, oxycodone, fentanyl, heroin. They're all in the same group. Obviously, we're not prescribing heroin, but you need to be aware of the risks with those drugs as well. The ideal thing, as I say, is to try and take the least amount of painkillers as possible for the shortest amount of time. And if you have chronic pain, trying to do everything else you can to mitigate and lower the amount of painkillers you're taking, because you're thinking like, I got to get through today with the pain I'm in. And that's really difficult when you're struggling with chronic pain or you're struggling with acute pain. But your clinician's also thinking about what are you going to be like in 3 years, 5 years, 10 years, 20 years if you continue to take these drugs and they kind of altering your brain chemistry or causing problems with your kidney function or your gut lining or whatever it might be, depending on the class. So hope this video helps you understand a little bit more about painkillers and what we're doing, why we're giving them to certain individuals. And yeah, if you enjoyed this video, please share it with someone you care about. Maybe they'll understand too. It's for education.